examine you and take pictures, and then I want to go over your chest and explain what I see and what you can expect. So what we're going to do is get you ready for surgery, and kind of go over some details, and then we'll examine you, we'll take some pictures and take your blood pressure, okay?
Great, sounds good. See, I got my buddy, he's out front. Pastor Daryl Pearson will be taking me home. Yeah.
The pastor?
Yeah.
Friend of yours, huh?
Good buddy of mine. Actually, we were roommates years ago.
Yeah.
We were in our addictions together. And yeah. It's a guy that did something full circle, so yeah, we just kind of met back up in life, and so he's my support today.
That's great, man.
This is Pastor Daryl Pearson. And so we've been buddies for a long time, actually. And so that's part of my secret world, is that, yeah, you know, he's just starting to get to know the real me, the guy that's been in lockdown and in prison, a mental prison, so to speak. So.
And I'm here just to support him and encourage him, and really just see him grow as he goes through something that he's been wanting to go through for a long time.
So, you've got good quality skin, which is very important for contraction. Give me a flex of your pec. Yeah, good. Okay, good. Why don't you tell me what you don't like?
Well, I definitely feel that there's, from this part on, there's kind of a sagging feeling with them. I feel that you know, this section here probably is the pinnacle of it. I feel it's just that fatty look, sagging look. Again, I see them coming in from these angles as well. I see kind of, you know, kind of extra fat there.
And so basically, it's this whole area that you don't like.
Yeah.
Okay. Why don't you flex your pec like you were doing? So it's this kind of stuff that's kind of there, right?
Yeah.
Okay.
I can see it right now, so I can't look down
Mm-hmm.
on the other side. Now, maybe when I was younger I could. So, but gravity has definitely set in on me. And so what I don't like is the protrusion, and I think the sagging.
In your goals, what would you like to see
My
when you
goals
look down?
would be to flatten this as much as possible. Would like to see these shrink as much as possible, and would like to see the thinning out of this extra fat on the side.
Okay, good.
It's just I don't know what it feels like to be flat chested. I have no idea what that feels like. Now, overall, first and foremost, that is what I'm looking at, and then definition, and then definition and having a defined chest area.
Now, I think that we're on the same page. I think we've communicated well what your expectations are and what our limitations are, which, you know, the folds, the issue that may be one. But other than that, I think you'll do very well. Overall, I think you should get a very good outcome. I think we'll be able to flatten this.
Mm-hmm.
I think we'll be able to reduce this bulge that you have here. And I think we'll be able to take some off here. You want to be careful that you don't create a divot here or something, but just a little bit less fullness here is going to give us more shape in your chest.
I've seen people that have come out with amazing results from modern medicine and how these procedures are such. So I don't have a whole lot of questions. I'm in a place of, I'm just in awe that the opportunity has presented itself in such a way that, I've looked at some of the before and after shots, and so I'm just, got this this sense of I'm just overwhelmed at this point. You know what I mean?
Well, that's great, man.
Yeah.
Well, we'll take good care of you. We'll take good care of you. All right, baby. Let's go, man.
All right.
All right.
Great.
And then I'll put put you sort of like in a waiting area.
Okay.
And then Dr. Gynecomastia will come in and give you a martini,
Yeah.
an IV martini. And then you'll wobble into the OR.
Okay.
And once you're in there, just so that you know, the worst part is going to be I'm going to have to prep you basically from your neck all the way to your feet. And so it's going to be really cold. So you're going to be totally naked, and you're going to be standing like this, and I'm going to cover your whole body with betadine. And then what's going to happen once that's all done, you're going to not touch anything on the bed, because it's sterile, except you're going to just go and sit your butt back as far as you can in the center, and lay down, and keep your arms out, and then just lay them down on the arm. I will go over this stuff with you again in the recovery room, but you probably won't remember a word I've said, because one of the drugs that we give you causes amnesia. And I can't tell you how many times people will say to me, have I had the operation yet? Yes, you're in the recovery room, everything went. When am I going into the operating room? 5 minutes later, you know, it's really fun.
I don't know, I feel pretty calm and relaxed, you know. I guess I'm excited to see what you know, what my chest is gonna look like, you know, after the surgery and after it heals and stuff, you know, because I lived with this condition for so long. I just, yeah, I'm actually excited to see a change for once, you know, and I know what this looks like, and I know what this feels like, and I just know it doesn't feel good, and it doesn't look good to me, so.
Hey, I'm Christine, and I'm the surgery nurse. I'm a circulating nurse. I've been a circulating nurse for 17 years. And 4 of those have been with Dr. Delgado. And today we're going to be doing gynecomastia, which is typically considered a male breast reduction. Well, I come in the day of surgery, and I have not met the patient before that day. I come in, I introduce myself, and I do a pre-op interview, that's what we call it, and I talk with the patient. I do some post-op teaching with the patient, and then I'll prep the patient, take them into surgery, and I'm the one that does the actual surgery with the patient. Afterwards, we bring the patient into recovery, and another nurse will take over and she'll recover the patient, and that's the extent of my contact with the patient. What's going to happen now is Dr. Delgado is going to come in after he finishes with the surgery right before yours. He's going to come in and mark you with some pins, mark you on your chest.
Okay.
Did you shave your chest?
Yeah.
Okay. And then Dr. Gaynor's going to come in. He's going to start your IV, ask you any last minute questions.
Okay.
And then I'm going to come back and give you a breathing treatment.
Okay.
And then you're going to walk yourself into surgery.
Okay.
Okay?
Okay. Sounds good.
And this is going to be your best friend for a couple weeks. It's going to go just like this. It's going to be tied at the top. It's not going to be Velcroed. We're going to tie it. It's going to be really tight under the armpits. And what we're going to do is we put foam under this, and there's going to be like Vaseline, and you're going to, it's going to be messy, but just leave it alone. Don't do anything with it. Don't take it off or anything until you see Dr. Delgado, your first post-op visit. And he'll be the one to take it off.
Okay.
All right, I'll let you guys say your, whatever you need
So.
to do.
Love you too. I'll see you guys when we get back.
Okay.
See you, Dad.
Take care.
We'll be.
Hope you have a good surgery.
Yeah, well, thank you very much.
Are you excited?
Yeah.
Good. We do so many of these surgeries.
Yeah, I know.
Did you do research on the internet? Is
Yeah,
that-
it's great chosen.
Well, my name's Laura Tomera, and I'm an RN that works here in the recovery room and basically takes care of the patients after they come out of the operating room. Make sure they're stable enough to go home, handles pain control, make sure they're comfortable and they understand their post-op instructions. And interestingly, whenever I have a male patient in here, I always ask them, how did you find out about Dr. Delgado? And they always say from the internet. And whereas women, it's not that much. So it's more of a word of mouth type thing. But with the guys, it's the internet. Most of the patients do really well, so I don't necessarily get to see them again. But I do know that after they come out of the anesthesia, they're very happy because often this is a life-changing event for them, and they're very excited about it.